Well, thank you so much for coming in for our Family Education Day.
Thank you.
All right. Can I turn on some light just so we can see each other
Yes,
well?
go ahead.
All right. Turn that on. And I'll sit here so we can talk. All right. And who do you have here with you today?
This is my cousin Rachel.
Hi,
nice to meet you.
Nice to meet you.
Yeah.
So today, the whole goal is really just to make you feel prepared and comfortable to go home. We'll go over your medications and some stroke education and make sure that you can monitor and take care of your diabetes at home. Do you have any specific concerns or anything that you're hoping to go over?
I just kind of wanted to see her medications just because I'll be helping her when she gets out of here.
Sure. Okay. And how about you? Anything specific?
I think it's just being able to check my blood sugar and give myself meds with just one hand.
Okay, very good. Well, first we can go over your medication list. I know throughout your stay we've been adding all of the education in regards to your medications here. And you have a chart here. It says the medication and then diagnoses. So the main diagnosis that we're focused on during your stay here is stroke, diabetes, and hypertension. Do you remember the medications you're taking for your stroke or stroke prevention?
I know one at the Tenolol,
Okay.
and then aspirin.
Yeah.
My diabetes meds.
Mm-hmm. Very good. So for stroke, you're taking aspirin, and that's to help prevent blood clots. And just as a reminder, anytime you're taking a medication to prevent blood clots, you are more prone to bleeding. So you want to look out for any signs of bleeding, excessive bruising, bleeding in your gums, or if you notice any bleeding in your stool or your urine, you need to contact your physician. And then Crestor, you're taking for your cholesterol. Something to look out for that would be like nausea and vomiting, kind of GI upset. And then Atenolol, you're taking for your blood pressure, but also to help prevent stroke. One thing to look out for with that is feeling dizzy or lightheaded, because anytime you're taking a blood pressure medication, it can lower your blood pressure. And then diabetes, I see you've been taking Lantus and Lispro. You've been on that for a while, right? Okay. So the Lantus, it looks like you're taking once a day at night. That's your long-acting insulin. And then the Lispro is the one you take with your meals. Okay, and you mentioned wanting to make sure you know how to check your sugar and being able to give yourself insulin. All right, so I have the glucometer here. We can practice just to make sure you feel comfortable with that.
Oh, that's nice.
Okay.
Now, do I get to take this home?
You do, yeah, this is yours. So you've got the glucometer in here and some test strips, and then this is the Lancet. So that's how you'll be, getting the blood to get the blood sample for your blood. All right, Liz, have you had a chance to do the glucometer while you've been here?
Yes, but I haven't been able to do it on my own.
Okay, sure. And Rachel, it's my understanding that you know how to do it. You've helped her at home.
Yeah,
before.
no, I helped her a couple of times, so I'm pretty good with it, I believe. So.
Okay, and then administering the insulin, you know how to do that as well?
Yeah,
Okay.
my dog gets it, so yeah.
Okay. Do you mind just showing me how you would do it at home, just so we can make sure you don't have any questions or concerns there?
You want me to check the sugar and draw out the insulin?
Yeah.
Okay, sure.
So yeah, you have all your supplies here, the glucometer, the Lancet, and then here are the test strips.
Okay, this is similar to the one at home.
And you always just want to make sure that you're washing your hands before you.
Oh, yeah.
Sounds good.
Alright. A little different. People watching me makes me a little bit nervous. Alright. Liz, do you care what hand I use?
The right one.
The right one? Okay.
Yeah, always make sure you clean off your hand first, either alcohol swabs or just washing your hands with soap and water at home is fine.
Yes. Okay. Yeah, might help if I actually loaded up the needle. Oh.
Behind your arms and your legs, wherever you can grab that subcutaneous or fatty tissue.
Picky boys.
for demonstration purposes, we're just gonna have you injected into the pillow.
Okay.
So whenever you get that, fatty tissue, you wanna give it a good pinch.
Okay.
Clean it off, and then administer at a 90-degree angle. All right, very good.
All right.
And then, Liz, do you remember the signs of low or high blood sugar?
With low, we're what's it called? Hot and dry when it's high, and then cool and clammy when it's low.
Very good. And in case you ever, forget or you want to reference, and for you too, Rachel, we have this whole diabetes self-management skills. So it gives you a lot of information on kind of what it means to have diabetes, how to monitor your blood sugars at home. It does give you some education on using the glucometer and insulin administration. And then one thing I really like in here is that it gives you a chart here about high and low blood sugar. Where is it? Okay, never mind. Forget that part.
I think I was looking at it.
It's in there somewhere.
There it is. Pretend.
Oh, okay, there it is.
Oh, it's really cool. Look at that. Well, that's good. You just can't lose it.
Yeah. And this whole patient education binder will go home with you. So you'll have the diabetic education in there, all of your medications that are pertinent to the diagnosis that we reviewed. All of the information will be in here as well. And then the last thing I wanted to cover was your stroke education. So this booklet here, has anyone gone over this with you while you've been here?
Yes.
Okay, just as a quick review, the whole goal of this is just for you to be able to identify your specific risk factors for another stroke and then what you can do to prevent that. So do you know what your risk factors are?
My diabetes, my high blood pressure. That's what I think of right now.
Okay. And then also the high cholesterol. So that's why you're taking, the specific medication. So again, just the aspirin to prevent blood clots, atenolol to maintain good blood pressure, the Crestor to lower your cholesterol. So this book just gives you a little bit more information on that, which you've already gone through during your stay. But one thing we always want to reiterate is the warning signs of a stroke. Do you remember that acronym that we went over with you? BFAST? Do you remember what they stand for?
B, balance, eyes, face, time. I can't remember the other ones.
Okay, no problem. And since your cousin
Yeah.
here, Rachel's going to be with you, I want to go over that anyway. So B is for balance. So if you notice that you're kind of losing your balance or feel dizzy, eyes, blurred vision, face, one side of the face might be drooping. Arms, one arm might be weak. One way to kind of test that is if you have your arms out, one arm starts to droop. And then speech may be difficult to understand, maybe kind of garbled, may not be making sense. If you notice any of those signs or symptoms, it's time to call 911. And the reason we say call immediately is because the quicker you get treatment for a stroke, the better the outcome. You don't want to wait for your neighbor to come over or whoever to come by. You just want to call 911 so you can get the best treatment. All right, well that covers everything that I wanted to go over today with you. Do you have any specific questions?
Will we get a list of all the medications that I go?
Yes, you will. So I know you're discharging in 3 days. On the day of discharge, you'll have a complete list of all of your medications. It'll give the exact dose and how often you'll be taking that medication. You'll have all the list of the follow-up appointments that you'll need to go to. And yeah, it'll cover everything you need to know for discharge.
Well, that sounds really good. Well, thank you. I feel a little bit better. Take some of the
Okay.
ease off taking that
Good,
home.
good.
So
Well, thank you so much for coming in to do this and helping Liz at home. And just thank you so much for your time today.
thank you, Jenny. The care here was just so good. So thank you so much for taking good care
Everyone's
of Liz.
really nice.
Well, I'm really glad to hear that.
Yeah.
All right, thank you so
Thank
much. You
you.
have a good day.